What's good with you YouTube veterans, military, troops? Back again with another banger. Today, we're going to be talking about chronic sinusitis, VA disability claims for those veterans who are trying to possibly win on an appeal, a supplemental, or if it's your first time claiming. As well as we're going to talk about the two most important areas veterans always get wrong on these claims. As always, like, share, subscribe, comment down below. Hit the like button. Don't cost you nothing. And let's jump into the topic. You know what I'm talking about? First of all, there's multiple different ways to get service connected for chronic sinusitis. One of the most popular ways right now is going to be under the Pact Act presumptive conditions. Presume the veteran got it during X deployment to these theaters of operation as well as countries. So that's a method to get service connected for it. Direct service. If you have any complaints in service related to chronic sinusitis, allergic rhinitis, you can always put in that claim. That'll be your link to service. As well as service aggravation. If you had, maybe mild to moderate signs prior to getting into the military, hey, that's a route you can take. Include secondary condition as well. If you're service connected right now for allergic rhinitis and possibly it's, causing chronic sinusitis, that's a claim in itself as well. Now, to get on the board, you need at least an X-ray. That'll get you a 0% VA disability rating for sinusitis. Moving on from there, 10% VA disability rating. You're going to have one or two incapacitating episodes of sinusitis with the symptoms associated with it. 30% introduces same criteria as the 10%. The only difference is now you're going in 3 to 4 times per year for these. Now, if you are some of the veterans who are very severe with your chronic sinusitis, and now you have to introduce surgery, you definitely got to get that surgery done in order to tap into that 50% VA disability rating for sinusitis. So you do that by, doing an exam and conducting the operation. And post the operation, I'm not saying, do the operation just to get the 50% VA disability rating, but if you conduct the operation and you're still having issues post-operation, that opens you up into the 50% VA disability rating for sinusitis, as well as possibly for secondaries on top of this as well. Remember, for any surgery, regardless of the location on the body, if it causes a secondary disability on top of the pain you're already experiencing due to that surgery, submit a VA disability claim, build that medical evidence, and submit that nice package. Moving on from that. Now, depending on your level of severity, your number of incapacitating episodes, symptomology, that's going to determine whether you get a 10%, 0%, or 50%, which is the max possible rating you can get for it. We understand. Okay, cool. You served, deployed, or supported in any of the various countries that's stated on the Pact Act. They can submit a claim for chronic sinusitis. Cool. But some of the things that veterans miss on this is going to be the proper diagnostic testing. A lot of veterans go into it thinking that, okay, I'm going to put in a claim for allergic rhinitis. I'm going to put in a claim for chronic sinusitis. And they're assuming that the VA is going to pay this third-party examiner to submit additional diagnostic testing. And no, that third-party examiner, that's extra money out of their pocket. So if you're not submitting MRI, CT scan, nasal endoscopy on top of this claim, it's going to get denied. Very few veterans are going to get called into an exam and possibly scheduled for any of those diagnostic testing that I stated. It's very rare. So definitely, prior to submitting that claim, you want to make sure that you have a diagnosis current and up to date alongside of what? Medication, treatment plan, whatever the case may be, frequency, how often is it occurring, as well as what are you trying to shoot for? Are you trying to shoot for the 50% VA disability rating, or are you trying to get a 30% VA disability rating for sinusitis? They confuse the incapacitating episodes with, complaints or self-reports. That's all cool and dandy. However, you need to have some type of, complaint record with your doctor, your primary care provider, things of this nature. Now, the incapacitating episodes. Now, the VA has defined an incapacitating episode as doctor prescribed bed rest. So, It's not, oh, I'm having issues with my sinusitis. Oh, my nose is, my sinuses are clogged. None of that. No, none of that. You take it off from work. Just, you're complaining to your supervisor and like, hey, I need a couple of days off. No. If you're having an episode, you're having an issue, go to the doctor, go to the ER, get the evaluation, get physician prescribed bed rest. This is going to be your medical evidence building from 10 to 30%. Because for 10 or 30%, you're going to need this medical evidence in order to tap into those VA disability ratings. And, obviously, if you're having severe issues with your sinusitis and it, introduces the need for surgery, you got to take care of that. Obviously, you have some issues and stuff going on. Hospitalizations. Best bet, I say, hey, if you can, go into the ER, urgent care. Definitely, if it's going to be 6 times plus a year, that's going to be ample, medical evidence, but you don't need that much. And the amount. So let's look at 30%. You only need 3 or more incapacitating episodes per year of sinusitis requiring prolonged from 4 to 6 weeks of antibiotic treatment and stuff like that. Pretty much, you're dying. You're hurting. You're not going to be going to work for 4 to 6 weeks, and you're going to be dealing with this pain that you got to self-medicate, medication, whatever the case may be. Now, pushing on from there, the difference between 30% and 50%, you can have 40 incapacitating episodes the entire year. Unless you was ever introduced to surgery, it's not going to put you into the 50% category. So we can look at the 50% following surgery. Yeah, right here. 50%. The only difference is, obviously, it's taking everything from 30%. When it comes to 50%, they're looking for that surgery. It's important that veterans get that medical evidence. Because if not, hey, you're going to be wasting time in the claims process, 6 months, a year and a half, 2 years. I know a lot of veterans who are still waiting on Pact Act related claims that they submitted, thinking that it was going to be a 4 to 6 month time period. But no, they're still waiting around. Why? Because maybe they didn't submit the right medical evidence. Maybe they didn't have enough medical evidence. Maybe it wasn't sufficient. Maybe it's confusing. Whatever the case may be. I know personal, closer buddies and stuff like that. Same thing, same thing. And that's pretty much it. I mean, we can do a recap. As long as you have your medical evidence, your deployment history, anything, that's going to identify, okay, cool, you served in this area, Afghanistan, Iraq, Djibouti. Hey, we've identified it. Outside of that, current diagnosis. You're going to need a diagnosis in order to get service connected for any VA disability. That's compensatable, That's all, if it don't make dollars, don't make sense, as always. But depending on 10 to 50%, 10, 30, or 50% incapacitating episodes, and if you have a surgery associated with sinusitis, then hey, that opens the door for that 50% VA disability rating or sinusitis. MRIs, CT scan, nasal endoscopy. If you have a, personal statement, you can tag it on there as well. This type of claim should be standard. As long as you have the diagnostic testing, you should be good. It should just be cut and dry. The CMP exam, this is where veterans you need to understand the questions that are being asked. I'll say print out the DBQ, bring it in with you. Do not rely on that CMP examiner to ask you every question, how it's supposed to be asked, or X, Y, and Z. Maybe that CMP examiner is missing a lot of questions. Maybe you walked in that exam room and you was in the lobby longer than you were in the examination room. It happens every day to veterans. And then they wonder why, what's going on, X, Y, and Z. But that's when you have to go and evaluate, okay, if you plan to fail, you fail to plan, obviously. But not a lot of veterans know that you can take in your medical evidence and everything that you submitted for this specific CMP exam. You bring it in with you. I've done it for all my exams. I recommend all the veterans, consult with, hey, take that notebook in. You know what I'm talking about? Take it in because it's going to help you out. As well as it's a professional type of, it's a professional interview. So pretty much Yeah, you know, treat it as such. I'm not saying you gotta go in there acting crazy, you know, looking like Boo Boo the Fool, but you just gotta make sure that you're going in there prepared for it. You understand the questions, you know all the questions that should be asked. And if not, I would simply let that CMP examiner know, hey, I got my DBQ, I got my medical evidence, I want to follow along with the questions. Let's begin. You know, if they got an issue with it, what are they going to do? Cancel the exam? They can? Okay, cool. You say your piece, they say their piece, and then you'll get rescheduled to a new examiner. And you just repeat, hey, you know. And honestly, that's about it. You know, chronic sinusitis VA disability claims is not too difficult to get service connected. However, veterans, they miss having a diagnosis. They miss having those incapacitating episodes properly well documented in their medical record. And they miss the difference between 30 and 50%, where the requirement of that surgery being conducted prior to, you know, tapping into that 50% VA disability rating. But as always, y'all like this type of content, like, share, subscribe to the channel. Hit the like button because it don't cost you nothing. Until next time, it's my fucking Devo out. Y'all stay Gucci with it.